Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Lagos State takes a cue from the federal government as it announces low-key Independence Day celebration amid the coronavirus pandemic. Tertiary institutions in Ekiti State set to reopen October 2nd. State government insists on strict adherence to the NCDC protocols. And Germany announces measures to limit size of gatherings and fine those who break tracking rules, as Chancellor Angela Merkel urges citizens to act patiently. And we've seen countries in Europe see a surge in COVID-19 cases across the world. But two studies have come to light today, and one of that is historically black colleges and universities in the U.S. are reporting lower coronavirus infection rates because students are better at wearing masks and observing social distancing. While the second study is that there are three main symptoms of the coronavirus infection, but new research suggests frail, older people can also experience delirium or confusion. So scientists are warning doctors and carers to look out for signs of confusion, drowsiness, or strange behavior in the vulnerable age group of over 65 because it could be an early sign of COVID-19. As you all know, it's still a multi-sectoral National Emergency Operations Center activated at Level 3 in Nigeria, and the NCDC continues to coordinate the national response activities. 187 new cases were reported from 12 states and the Federal Capital Territory, with Lagos leading at 74 cases, followed by Plateau State 25, Rivers 25 as well. Gombe 19 was also recorded in the FCT, and you can see several of the other states there as well. Now, after last night's numbers, a total of 58,647 cases are now confirmed and 49,937 recoveries made. Our death toll is still at 1,111. According to the Health Minister, Dr Sage Hanire, about 10% of the total cases in Nigeria are below the age of 19 years, indicating that even though adults, especially those 60 years and above, are more vulnerable, complications can occur in all age groups. Now, ahead of the likely resumption of tertiary institutions in Ekiti State from the 2nd of October, the schools concerned have been putting facilities and plans in place for a smooth reopening. Tertiary institutions have been on lockdown for about 6 months in Ekiti State, and the management expressed their thoughts and also the new strategies with regards to the new normal in the country.
After about 26 weeks of shutdown of schools in Ekiti State and other parts of the country, tertiary institutions are getting ready to welcome students back to the classrooms. With the ease of COVID-19 restrictions and phased resumption of schools, the state government approved the reopening of tertiary institutions from the first week in October, setting in motion strategies by different institutions to imbibe the new normal and ensure compliance when students come flooding back in. Temperature checks are being carried out at the entry point of the Ekiti State University, Ado-Ekiti. The management of the school says technology has also been factored in to allow for fewer in-school participation. Activities within the premises of the Afe Babalola University, a private institution, includes fumigation, installation of disinfectant tunnels, hand-washing points, and other safety protocols. Still, the state COVID-19 task force is here to ensure the school is ready to receive students. The founder of the institution, Afe Babalola SAN, believes that schools should have been primed to resume earlier.
COVID-19, like other pandemics that had existed long before Christ, are still with us. We have to manage it. We have to look for how to manage it. Malaria is with you, influenza is with you, and many others. And they are many years old. So the way my mind is working is that government should have reopened universities much earlier.
We've visited various areas, the administrative buildings, the hostel. We're ending up at the hospital here, and at least my initial reaction is that they have prepared well for us, and we are impressed, but we'll go back with the team. I know that all of them have been making some notes, and we'll go back and discuss it. Within a few days, we'll come back with our verdict.
As an addition to preparations for next week's resumption, both institutions also have molecular laboratories in place should an emergency testing be required.
Now, Lagos State government says it's opting for a low-key celebration of the 60th independence anniversary due to the ravaging effect of the coronavirus pandemic. Governor Babajide Sanwo-Olu therefore directs that all planned parades and other activities that involve the gathering of more than 50 persons should be cancelled. The governor also congratulated Lagosians on the occasion, strongly advising that they celebrate quietly at home and pray for the country. In the meantime, the Lagos State government is still receiving support from concerned bodies to help reduce the impact of COVID-19 pandemic on its residents. This time, the support is coming from the United Nations Development Programme, UNDP. Our correspondent, Titi Layo Abirawo, has the story.
As the world continues to grapple with the impact of COVID-19 pandemic, Nigeria seems to be easing out of the pain gradually, with strategic moves to revive the impact on the economy and its citizens. The United Nations Development Programme is one of the agencies the Lagos State government is partnering with to elevate the impact, with the launch of the unconditional cash transfer for vulnerable communities. A major focal point is the poverty level, which appears to be on the rise.
22,600 families from Lagos State will benefit from the cash transfer, while 5,500 SMEs and startups will also be funded through the business continuity and startups under this cash transfer program.
Good afternoon, can you hear me?
The European Union ambassador to Nigeria joins the gathering virtually, and for him, the global pandemic is yet another opportunity to address all loopholes in the health sector.
If ever nobody is any more in doubt of the importance of investing in human capital and in basic social services, some of the challenges in the lack of health facilities and services in a country like Nigeria have become quite evident during a crisis like the one that we face.
The Nigerian government at all levels is also not lagging in its responsibility, as clearly spelled out by the Lagos State Governor and the Senior Special Assistant to the President on Sustainable Development Goals. For them, support can never be too much.
There is no gainsaying that COVID-19 has impacted negatively on our social economic well-being as a people, especially the vulnerable segments of our population. And as a responsible and responsive government, we have implemented and will continue to implement palliative measures aimed at sustaining lives and livelihood.
UNDP is indeed a reliable partner and will look forward to sustaining this relationship, especially at this time of decade of action.
Over 22,000 Lagos residents are expected to benefit from over 800 million UNDP fund to cushion the effects of the pandemic. Titilayo Abirawo, Channels Television News.
Now, it's still the rainy season and there has been widespread flooding in some states in Nigeria. In addition to the unfortunate displacement of people and their means of livelihood, flooding also increases the risk of waterborne diseases. Well, this year, the NEMA, that's the National Emergency Management Agency, has warned that flooding may affect over 250 local government areas in 28 states of the country. The head of the Nigeria Center for Disease Control's International Health Regulations Division, Dr. Ladu Okunromade, joins us from our Abuja studios on the measures to prevent infectious disease outbreaks during flooding. Thank you for joining us on the program. First, I'd like to begin by asking how flooding, if it has affected the coronavirus response in this state, especially those badly hit like Kebbi, Jigawa, and recently Kogi State.
Okay, I would say that the indication of the reported cases from these affected states, it's as a result of the number of tests that is being performed in these affected communities, and not necessarily because of COVID. And the affected states that are not reporting COVID presently shows clearly the number of samples that are being conducted within the states. It's an indication that the states are not collecting enough samples, and it shows the attitude as well as the belief of the people within the community, and it shows that there's still a lot of mistrust and a lot of stigma surrounding COVID-19 testing within these affected communities. But if we look at it in another way, if during flooding there is usually disruption and displacement, and if the access road where the test is being conducted or access road to healthcare services within the communities are affected, this may affect the test that is being conducted within this region. But it's largely due to the number of tests that is being conducted and has nothing to do with flooding.
All right, so flooding, we know, can also contaminate water used for domestic reasons, drinking, and then hand washing, which is one of the non-pharmaceutical protocols. To reduce the risk, what should people who live in these flood-prone areas be doing as precautionary measures?
Okay, so it's important for us to emphasize that the benefit of hand washing goes beyond just COVID-19. When we're talking about hand washing is a basic measure to prevent against major infectious diseases, and not just COVID-19. It's not COVID-19 specific. And hand washing also prevents against cholera, which is common during flooding, and also it prevents against other infectious diseases. So the important message is to ensure that people during flooding, they ensure that other preventive measures to prevent infectious disease outbreak are being enforced. Things like food hygiene is being practiced, such that they ensure that they eat their food properly and then eat hot food, ensure washing of fruits during this period, ensure that they have, they should ensure that the availability of safe and potable water within the affected communities. And for hand washing, of course, we can't overemphasize the benefits. And for COVID, there are other preventive measures that people need to practice. Ensure that they wear their face mask, ensure that they maintain physical distance as much as possible, and also they need to ensure that they practice cough hygiene, and people should learn how to cough into their elbow. And also, if there is no access to water, they should ensure that they have hand sanitizer available at all times. So those are the basic measures that we need to ensure that we emphasize, and also ensure that we emphasize to people that hand washing is basically not for COVID, but also it prevents other infectious disease.
All right, so a lot of awareness essentially. But just like other countries are dreading the winter and the fear of more cases as a result, how true is the assertion that a cold or a wet environment, the rainy season, aids COVID-19 transmission?
Presently, basically, there's actually no data to support that, although there is a lot of research ongoing which may prove otherwise. But there is this general assumption where that the transmission of COVID-19 virus is via droplet, and survival of droplets depends on the size of the droplet, or it depends on things like humidity. And of course, the droplet thrives in a very humid environment, kind of a cold weather. And this, of course, makes the the virus to survive longer than usual in a cold environment, but these are assumptions. Research are ongoing, which may prove otherwise, and until it is backed by data, we cannot come out to categorically say that during winter or during cold season, we usually experience a spike in COVID-19.
All right. We'd like to appreciate your time. Thank you so much, Dr. Oladun Okuromade, Head of NCDC's International Health Regulations Division. Thank you for joining us on the program.
Thank you for having me.
When we return, we'll tell you about Gombe's regional disease surveillance system. Please stay with us. 114 primary healthcare centres have been given starter parks through the Regional Disease Surveillance System Enhancement Programme to enhance their capacities towards containment and prevention of COVID-19 in various healthcare facilities in Gombe State. The starter parks are meant to protect health workers as well as clients visiting health facilities in all the wards of the state. The Deputy Governor, Dr. Manasseh Jatau, joins primary healthcare coordinators to ensure that it trickles down to all 2,218 polling units of the state.
We are gathered here today to support continuity of healthcare delivery for non-COVID patients by designating and equipping the 114 referral primary health centers in all the wards of the state with starter packs so as to help them discharge holistic healthcare services female population. These starter packs contain the following items: medical mask, examination gloves, heavy-duty hand gloves, boots, reusable aprons, hand sanitizers, liquid soap, plastic sharp containers, face shield, biohazard bags, disposable, digital thermometers, sodium hypochlorite, and Veronica buckets and taps.
The attempt today to ensure that all our 114 wards are equipped with these items is a very laudable program of the state government, and particularly a good thought by the COVID-19 team. So may I use this media to appeal to the population that please, they should do whatever they can do. They should listen to the experts, follow up until the fight is over.
Now, a lot of people are still talking about President Donald Trump and rival Joe Biden's clash over vaccines and masks during the first debate. We have Dr. David Ajibadi. He's a public health physician, CEO of Brain and Body Foundation. He joins us from Virginia in the United States. Thank you for joining us on the program.
Thanks for having me.
First, I'd like to get your views about what many have described as heated, the first debate of President Trump and Democratic challenger Joe Biden. I mean, the two sparred over many areas, but I'd like to get your views on healthcare and the COVID-19 pandemic. First, what are people in Virginia? I mean, after that debate, what are you hearing? What did they think about it?
Yeah, it was a bit of a brawl. I mean, it's probably one of the worst presidential debates I've seen in a long, long time. People were just talking over each other and basically calling each other names. So it depends on who you ask. So the people on the left, the Democrats, all thought it was a wipeout. President Trump was beaten badly by former Vice President Biden. And of course, on the right, all the Republicans, they're all saying that, oh, it was a complete opposite. But when you come to think about it, 2,000 deaths, over 2,000 deaths in the country is still a big talking matter. And there were a lot of blame to be thrown around.
And it's interesting to note that, I mean, Mr. Biden accused President Trump of how he handled the pandemic with the many deaths the U.S. has witnessed, over 200,000, and then reopening the economy too soon. And then you have President Trump saying that his administration has actually done a great job, better than the challenger. For you, what do you think about their stance on the pandemic, COVID-19?
Yeah, I mean, there's a couple of things the president did right. He shut down the borders to entrance into China. He tried to keep things going. But the argument against him is the masking situation, the social distancing. In some cases, he was ridiculing that. And based on science, it clearly shows that the masks work, not just in the Western world, but all over the world. They've done studies in Hong Kong, China, other places where they use masks, and that helped to reduce the spread. In fact, they're saying that if they continue with masking and they do it effectively, they can save 100,000 lives before the end of the year. But if they don't, it may not. So in a way, the president hasn't enforced that like he should. But on the other hand, because of what the pandemic has caused in terms of loss of jobs and loss of business, schools being shut down, the other pandemics, what I would call the other multiple pandemics, the financial loss, the mental health stress, increase in domestic abuse, that has increased so tremendously that people are even wondering whether the cost of the pandemic itself is not as much as the fallout from the pandemic. People are, all kinds of crazy things that are going on here. And what President Trump is trying to do is trying to reduce that, trying to get the businesses back working. I think, in my opinion, Melissa, I think what would have been best was to have been a more structured approach to the lockdown. The people who are more vulnerable, the elderly, the sick, should stay at home or work from home, while the younger people should have been given some kind of chance to work and at least keep the economy going, because one can see that there has been a great toll on this country. So, like I said, there's blame to be thrown around on both sides.
All right, one can say what a time to be president of a country. We'd like to thank you. We appreciate your time, as usual. Dr. David Ajibadi, Public Health Physician, CEO of Brain and Body Foundation. Thank you for joining us.
Thank you.
Now, German Chancellor Angela Merkel has been responding to the rise in infections in recent weeks, appealing for Germans not to let down their guard against COVID-19, as rules and restrictions would be a waste of time if people do not observe them. She told MPs that she defended the billions of euros of extra debt Germany was facing in 2021, that she is sure that life as we know it will return, and that Germany was facing a difficult phase. Here's more on our global update.
We begin in the UK, where cases have risen above 400,000, and Tuesday saw the highest daily toll since mass testing began.
Mr. Speaker, actually, I think that
Prime Minister Boris Johnson, who has announced new measures to curb infections, was reprimanded in Parliament today by the Speaker for treating lawmakers with contempt by rushing through far-reaching COVID-19 restrictions without proper scrutiny. Residents of Madrid's confined working-class neighborhood of Orcasitas have been tested for coronavirus as part of the city's mass testing campaign in an effort to track the virus and isolate those who test positive. Since exiting a strict lockdown in mid-June, coronavirus cases in Spain have soared, with thousands of infections diagnosed every day. Hospitalizations, though lower than the March-April peak, are also on the rise. Russia has reported nearly 9,000 cases of coronavirus in the last 24 hours, pushing the nationwide tally to 1,176,268. Authorities say 177 people died, bringing the official death toll to 20,722. The number of daily infections has more than doubled compared to late August. The new upsurge was recorded since schools were reopened on September 1st. The Israeli parliament has approved a government-backed edict that is likely to stifle protests against Prime Minister Benjamin Netanyahu over alleged corruption and his handling of the coronavirus pandemic. The legislation, ratified after an all-night debate in the Knesset, bans Israelis from holding demonstrations more than 1 kilometer from their homes, a measure the government says is aimed at curbing COVID-19 infections. Finally, North Korea's media says leader Kim Jong-un has reviewed anti-coronavirus measures, adding that participants found some faults in their implementation. The state-run KRT aired a video of leader Kim holding a meeting of the ruling Workers' Party's powerful Politburo on Tuesday. It, however, did not elaborate on the faults.
You can take a closer look at some of the updates on COVID-19 in real time. Visit our website, channelstv.com. There you get a better understanding of the trends on the virus, plus several other stories on the eve of Nigeria's 60th independence anniversary. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.